Sanibona, Dr. Mlungisi Dongwe Luminjalo Medical Centers, and today sikhuluma nge-topic ekuthiwa screening in healthcare. I-screening isho ukuthi uma ngabe sihlola abantu abaningi sizama ukuthola noma sizama ukuthi sandise amathuba ukuthi sithole kulabo bantu labo angenze ukuthi banesifo lesesuke sisihlolene. Izibonelo ezinhle zinto ekuthiwa screening in modern medicine izinto njenge-pap smear. Ngiyazi abantu abaningi beza u-pap smear bavele bathuke bacanga ukuthi i-pap smear, and people become apprehensive about it. They're scared. Is it going to be painful? What is a pap smear? So asikhulume kabanzi kancane ngendaba ye-pap smear. So uma ngabe ubuka kumuntu wesifazane umlomo wesibeletho esithi cervix, kunendawo laphana enokuvama ukuthi after as ekhula and when they are sexually active inamathuba ukuthi ingaba ne-infection engagcina ilidela to umdlavuza ekuthiwa i-cervical cancer. It is very common, especially in South Africa, kakhulukazi thina zabantu abamnyama besifazane, of course. So over a period uthola ukuthi umlomo wesibeletho ugcina ube noshintsho laphayana, and then ungagcina kulidela kumdlavuza. So not long ushintsho lusuke lukhona kusuke kumdlavuza, sometimes kusuke early changes ongagcina sekuba wona umdlavuza. So that's why we recommend ukuthi abantu when they commence ukuthi babe sexually active bezibandakanya ocansini, kubalulekile ukuthi from the age of 18 kubalulekile ukuthi babe nama regular at least yearly pap smear examinations. And in pap smear what we do is dokotela can be a GP, can be a gynecologist. The test yakhona should not last more than 5 minutes. So what the doctor does is kunento engazuthi njenge-earbud ene-brush phambili and it's soft. So what the doctor does is bafaka into ekuthiwa speculum into the vagina. Speculum lesenza ukuthi kuvuleke kahle passage, and then they just touch umlomo we-cervix lightly so that ama-cells njalo baleyo cervix ingxenye yayo kusale kuleli brush bese lithunyelwa elab bese beyacwaninga lapho under microscope, and then they're able to see if khona noshintsho olungenzeka ukuthi seku-early changes ongenza ukuthi kungagcina sekulidela to umdlavuza. Then mase sikwazi ukuthola lawo ma-results la sikwazi ukumguide ukuthi umuntu mhlawumbe ephinda futhi wenze nge-pap smear emva kwa-6 months, emva kwa-3 months noma unyaka, or even mesibona khona into ethile sibona i-suspicious even just after sifake i-speculum, then singa-decide ukuthi mhlawumbe udinga ukuthi kwenziwe i-LETS la khona kusuke sishisa umlomo wesibeletho leyo ngxenye le egulayo, noma kwenziwe i-cone biopsy sometimes where sika the first part of the cervix carefully, of course, and this is done by a gynecologist. So ngiyama-test enziwa le it's a form of screening. So next time we're going to landelayo sesiyokhuluma as well nangamanye ama-screenings akhona out there in modern medicine. But njengoba ngisho ukuthi this one uma ngabe ukhuluma nge-screening kufuna kube into eyamukelekile kubantu abaningi, ngoba i-screening doesn't always mean you're going to diagnose, but it just means ukuthi udokotela ufuna enze uphenge noma ucwaningo oluthile olungasiza ukuthi sheshe sibone if nawe ngenzeka usengozini ukuthi ungagcina udevelopa isifo esithize. So pap smear, go on ladies, go and get a pap smear done. It is important and it can save your life. Dr. Dongwe Luminjalo Medical Centers in Pietermaritzburg. Ngiyabonga kakhulu. Please subscribe to our channel yet so that we will more health information in small usable measures. Ngiyabonga.